Thanks for listening to the Wild Health Podcast. For the foreseeable future, you're not going to hear our normal intro or outro here. We're going to be releasing episodes very frequently as things are changing. This channel will be used for a very specific purpose. Number one, to communicate with our patients. We're somewhat overwhelmed, and the more we can communicate breaking news and recommendations from us to our patients all at once, the better. So if you're a patient, we're here for you if you need us, but if possible, please tune in here so we can both keep you up to date and conserve our time for the most critical tasks. Feel free to share this with friends and colleagues as well. Number two, we've organized as a group. We have infectious disease specialists, ER doctors, critical care doctors, and in total dozens of MDs, PhDs, and frontline clinicians who are going to be constantly evaluating the news and emerging evidence. We're then going to summarize and translate that for you here every day on the podcast. The speed of change with the circumstances will make us look foolish at times, but we're committed to pouring all of our resources and energy into doing what we can to help and make a difference. You can also follow our updates at wildhealth.com or our Instagram account at wildhealthmd. And if you're a patient, we're here for you. Please tune in here for the updates and let us know how we can help. Dr. Brian Adkins, thanks again for coming on the Wild Health Podcast. We wanted to have you on specifically because you've been sending me a lot of stuff recently by text and email about PPE, personal protective equipment. So you really seem to know your stuff on this, and some of the things that you've been sending I think are good for anybody to know, whether you're a medical professional out there or if you're just worried about this in general. So let's talk about personal protective equipment.
Let's do it. And first of all, I want to say thanks for having me on. I'm a huge fan, so I appreciate you letting me be part of the team for a little bit here. And secondly, I probably should clarify, I'm not an expert at PPE, but I spent the better part of the last 3 days learning everything I can about what is out there, and the information is rapidly coming in on PPE and our alternative options to it.
Yeah, and I think being an expert on PPE is relative. I mean, you're an ER doctor who has worn PPE thousands of times, and you know how important it is. I mean, this is literally potentially life and death for us in this situation. So I would consider you a pretty good expert, and you've been going down this wormhole reading about it just because of how important it is to you and the people you care about, your colleagues in the emergency department, in the ICU, and on the front lines. Paramedics and others as well. So can you start by just defining what PPE is?
Yeah, PPE is as simple as saying personal protective equipment. That name gets thrown around, or that acronym gets thrown around a lot, but that just basically means what doctors and nurses and other medical providers put on their body to limit their exposure to illness that they may collect themselves or that they may pass on to another patient later on. So typically that would go along with your gown, your gloves, your mask, your eye goggles, even your surgical booties that people wear.
So what is it being used for specifically with COVID-19?
Well, COVID-19 is, because of the significant communicability of this illness, PPE is really come to the forefront here. It's way more important than anything we've treated in a long time. And I think that the reason we've seen that COVID-19 has been such a threat to us is because it's so transmissible. And so obviously your ability to keep from acquiring or carrying that illness and passing it along to others becomes of paramount importance. And PPE is the barrier that we have between collecting something, in many cases, like a trauma case that you and I have been involved in many times, we're trying to protect ourselves from blood from a patient. Or occasionally you're trying to protect yourself from a patient's secretions from your own. But in this, it's unique because we're trying to protect ourselves from either the droplets that come or the secretions that come from someone who has COVID-19, or even the aerosolized particles that could be carried. And so this is a unique situation where probably most doctors are gaining their largest education on PPE than they've ever had in their career, because I don't think it's ever been more important throughout my career than it is now.
Yeah, I can't count the number of times I've kind of rolled my eyes and dreaded putting on PPE for a trauma or some other situation.
How many times do you have a patient comes in that they're going to have a few abrasions, but nothing that is going to get all over your body, and or you go to see someone and the nurses place a sign outside the door. But this is a totally different animal, and so if I could define what PPE probably is best for COVID, I think in general what we're recommending is the eyes covered with goggles or glasses, an N95 respirator or a mask, depending on the situation and your access to supplies, a gown and gloves. And what makes it more complicated is all of these ideally changed from patient to patient, which is going to lead to part of the problem that we're discussing today.
Yeah, it's hot, it's uncomfortable, you're soaking wet from sweat after you take it off. Nobody likes to put it on, but no one is skipping it with these COVID-19 cases now, and that's what's leading to the problem. So I can tell you anecdotally, I mean, I just got off a shift, and when I got onto my last ER shift, I came in and they said, okay, everybody gets one mask per shift, which is unbelievable and ludicrous. And so anecdotally, you hear those kind of stories, but do we have any data on shortages right now?
Well, like I said, ideally you're changing your PPE between each patient. But like you said, that the current shortages have left us in a situation. I won't go over all the details of that because optimal PPE, like you said, it's a word that we don't have to afford right now, which is not optimal. People are being told to hold this for one time, and actually, probably the shortage in PPE, as expressed via social media. Michael Gibson, the cardiologist from Harvard, put on his Twitter account a poll and said, how many of you are experiencing difficulties with PPE? And for what it's worth, out of the replies, a third of those people said that they're working without masks, and half of those people in the areas that they were said that they were being asked to use the same mask for an entire day. And it sounds like you're in the situation of being asked to use the same mask for an entire day. And so, to tell you the way that I understand the shortage to be is that we've enacted federal emergency status in order to acquire military access to what we have stored and that what Homeland Security has stored. And to best give you my expectation of what I believe the shortage to be or expected to be is that University of California, San Francisco issued a request to the community for any PPE that's owned by citizens or other offices to be dropped off at their hospital, accepting donations. And hospital systems from Providence, Providence, Rhode Island, to Deaconess and Evansville, Indiana, to Henry Ford and Detroit have all issued actual pleas and videos for volunteers and friends of the healthcare system and the community in order to create their own PPE because they feel such a desperate shortage. And it sounds like you, and I know where you're working, this ER shift that you're talking about at a rural place in Kentucky is already limiting you to one mask. And you told me recently that you actually had to ask for a mask that was your size, because I think what we're going to see is the difficulties of actually being able to staff the level we want to. And, if you look at what happened in Italy, a legendary Italian doctor passed away because he was treating patients with not necessarily he passed away because he was treating patients with PPE, but this was a doctor who was known to treat his patients without PPE once the shortage came up, and he volunteered to take care of people without PPE, and then he later passed away. And so with the CDC issuing statements about preservation and the CDC issuing statements about what to do when there's no PPE and the World Health Organization warning people about it, I think that tells you that PPE is going to be a significant shortage nationally by the experts, and that we're already facing those shortages in the urban areas that have been hit hard. Probably the most striking thing I've got across my email in some time was when John Mandrola wrote an article on Medscape that discussed the shortages of PPE, and he titled that "Some of Us Will Die," and that went out to everyone who's a Medscape subscriber by email.
Yeah, I mean, I think I get frustrated just talking about the problem, but it is important for people to understand the scope and just how much this matters when you get providers on the front lines that don't have it. So it is important to talk about it. But
we got 2 ER doctors in critical condition right now, and so I don't know any better way to tell people how important it is to protect yourself, knowing that there are 2 ER doctors. One's a year older than me and 43 years old.
Well, let's talk about the solution. I mean, you think the best solution is either conserve or to produce more or homemade. So I guess before we start talking about those different methods, it's important to talk about the hospital equipment specifically. What makes it so effective? Why is it different than just wearing a bandana around your face or something like that?
Well, first of all, what makes the hospital equipment so effective is the disposability of it. Obviously, if you can get rid of it between each patient, you're getting rid of a potentially contaminated piece of clothing that you can not hopefully carry to the next patient. The charging of some of the fabric actually carries with it the ability to kill certain microorganisms. The filtration ability of the hospital grade equipment is actually about 1/8 of a micron. The COVID-19 itself is about 1/8 of a micron. So the filtration ability of the hospital grade equipment goes to a very, very small amount, much smaller than woven material. And we'll talk more about that later. Actually, to get into a whole lot of the engineering details of it, which I unfortunately dug myself into recently, it's a melt-blown, non-woven fabric that itself, called polyethylene, that is produced primarily overseas and sent here, and it's in significant shortage. And this specific melt-blown uniform material is very effective at filtering out small particles. So that's one of the most important parts, and that's one of the parts that makes it so difficult to reproduce. Finally, the seal, the equipment that's made for the hospital, is made with the ability to seal on your face. It's made with considerations of breathability. This polypropylene, as I told you about, is specifically well made for this. If you go back in studies, which I try to go back through medical studies to try to see what made it superior or inferior, there's actually studies back to 1978 touting the advantages of synthetic material over cloth. If you remember on the old mask TV shows, those guys are wearing cloth masks. And so here in 1978, this was probably a big piece of research saying that we should really be going with the surgical masks that are synthetic. In 2015, actually, they did a study. The British Medical Journal published a study of 1,607 hospital workers, and they compared the ones wearing the surgical mask to the ones wearing the cloth masks. And as you might imagine, the folks wearing the cloth mask got a higher rate of infections over the time that they were wearing them. And a disaster medicine journal published in 2013 that homemade masks should be used as a last resort. So Brian, I think we talked a lot of the reasons about why it's superior, and it's even proven scientifically to be superior.
So Brian, these clear studies, did you see the CDC post about wearing bandanas? I mean, do you think they're just that we are in that desperate of a situation? I mean, that seemed almost dangerous to me, to be putting out information that a bandana could potentially help protect you against this when the virus particles are much too small.
Well, sadly so. I think that we're in a situation, not necessarily where I'm practicing in the United States at this moment, but I do believe we're in a situation where we have to consider what would happen if we truly had nothing. And I think that the fear is that we may get to a situation where we do have to use such rudimentary protective gear as a bandana. And so that's one of the reasons I wanted to go over some of the things today, because I do believe there's probably a middle ground between the hospital-grade equipment and using a bandana that hopefully could be utilized far before we get to that status.
Well, so that we don't get there, because we're approaching it very quickly and already there in some places, how do we preserve PPE? Are there any strategies specifically that we can use to preserve as much as possible?
Well, actually, there are ways that we can try to recycle it, and I don't know how effective they are because we've not been in a situation where we've been forced to do it. Certainly, you told me what I believe is the most common piece of advice that's being given out by the experts at this time, which is to reuse between patients or to use a mask for a period of time. And I think a common thing that is being told to people is only to use N95s or certain protective equipment with certain high-risk patients, or to keep your mask for the entire day. I think a lot of people are being told that. We've certainly implemented certain strategies similar to that at our hospital. I think a lot of hospitals are attempting to the most sacred of pieces of equipment that is hard to come by right now is the N95 respirator, which is my understanding people are using alcohol to clean those between shifts and reusing them between shifts. They're keeping one for the entire shift. At our hospital, we have a system where we're actually putting them in bags and labeling them individually for people. I think that if we're going to try to reuse the most sacred of the equipment that we're trying to preserve, that our best method that I have run across is actually in Nebraska. Nebraska Med actually has a pretty good step-by-step set of instructions where they are recommending UV radiation for disinfectant purposes of N95 masks. And they're citing a couple of studies, one from the Journal of Occupational Hygiene, or Journal of Occupational Environmental Hygiene in 2015, that essentially says that UV radiation could be used to disinfect respirators, and the only thing that came up with is over a period of time with their current use and exposure to radiation that those materials would wear down, although they seem to believe that it took quite a bit of use and radiation to wear it down beyond the breathability and the filtration rates to not be effective. And so if you would like to go, and I think we should post these probably in the show notes, Nebraska actually has a pretty good system for this. And the CDC actually on their website has posted another study that suggests that UV radiation could be effective in sterilizing personal protective equipment.
So did you read anything about how long you could continue doing that before the N95 no longer works like it should?
It does not have that, because I don't think they used, in the study that I read, and maybe you've been exposed to something else, the study that I read, they did not speak with regards to the length of time. All they did suggest, though, that was with recurrent use and radiation exposure over a period of time, that the fabric did wear down a little bit, and the fabric wore down quicker than the strap did. It was one specific piece of commentary, and that you could expect some wear and tear on the item, but not at a rate that would lead you to not be able to use it over. And I think that we may be approaching a situation where the situation exceeds the science. And so we may have to, if we can set up effective UV radiation equipment to reuse our masks, we may have to learn by doing, and we may have to rely on the masks until we have more, which may not be coming.
Yeah, both of us are on an email string with a bunch of other physicians, and a couple people were talking to some dermatologists who have these UV lamps, talking about whether that's going to work or not, repurpose some of those. But from my understanding, Mike talked about this in a prior update. It's very specific. I think he said 220 nanometer wavelength light, so it's not just any UV light. But what about just sunlight? Do you have any idea? I mean, this is not a study of just sitting it out in the sun, but do you have any idea if that would work and how effective that would be from what you read?
I have personally not been exposed to anything regarding sunlight itself. Obviously, my understanding of the COVID virus is that it is particularly susceptible to heat, but I do not know what duration of sunlight or UV rays from the atmosphere would be necessary to feel comfortable eradicating the viruses off the mask.
Yeah, and the heat that I've seen is after about, I think it was 9 degrees Celsius, which is something I'm going off the top of my head. I think that was like 50-something degrees Fahrenheit. It starts to become less viable at higher and higher temperatures until we think around 140 to 150 degrees is where you definitely are going to be killing it. But that you're not going to get that from sitting it outside. But I don't know. There may be some effect, but we just don't know. So we shouldn't speculate, I guess, whether sitting outside would work.
I think if we end up in a situation where we don't have any other choice, would I choose at this point to wear a bandana or an N95 that I wore the previous day that had been set under a heat lamp or set outside? I would choose probably myself, not as giving medical advice to others, but I would probably feel more comfortable with an N95 that had been exposed to heat and the sunlight at this point.
Yeah,
but
100%.
I think that we probably, some of us that have not been impacted as heavily so far, probably have more time to get on board with what Nebraska is suggesting with a more formal, more proven strategy, hopefully.
What's the difference in a respirator and a mask? You use both of those terms here.
Yeah, well, I think I would just stick to simplicity. I think when we're dealing with a respirator, we're talking about a tight-fitting piece of equipment that would theoretically, because of its ability to seal, would theoretically filter at a much higher level. With a mask, you're just talking about something you're placing on your face without being sealed specifically to the skin, so it does filter what goes across that. But with a respirator, hopefully not only is it filtering what goes across the material but also also holding close enough to your body that you cannot get exposed around the edges as well. In the hospital, the common thing we would call is the N95 respirator mask, and then also just a simple surgical mask. And the N95 is a thicker, more substantial piece of equipment that holds much tighter to your face. And in fact, in the hospital, we have to go through an aerosolized series of testing to make sure that our fit is appropriate so that it does not leak around the edge.
Now, you sent me a picture the other day of a respirator that you found at a hardware store. You were getting one for yourself, and I had you pick me up one as well. What is that? What was that exactly?
Well, I think this brings up your question. Probably brings up what we should discuss, which is what other alternatives do exist in the community besides recycling the equipment that we've discussed that the hospital provides us. So the hospital provides us certain materials and equipment that we've already discussed as superior equipment. But what do we do whenever we do not have options of recycling, reusing, we run out of those? And the best thing that I found with regards to finding a respirator was actually in the industrial world, which is by using respirators that are actually typically used for people who do construction, labor, painting, who are exposed to dust, asbestos, all those particles. And my understanding is any NEOSH certified respirator with an appropriate filtration system can work. The two most famous brands of that are Miller and 3M. And I actually went to a small town hardware store. If you look online, it's become very, very difficult, almost impossible, to find a respirator for sale, an industrial respirator for sale. And in fact, a lot of my family members are involved in skilled laborers, and so they have kind of scoured their sources as well. And they're very, very difficult to find right now. I was lucky enough to go to a small town hardware store and get the last 6 for me, you, and some of the ER doctors that we do. And so theoretically, although this is an item that basically makes you look like Bane from the Batman trilogy, it would be certainly, you would stand out as you walk through the doctor's charting area with this mask on. Theoretically, you would be providing yourself similar, if not more, protection from aerosolized spread with this mask on, or this respirator on, than you would an N95. So I think if we get into a situation where there's a severe shortage, people who have a reusable industrial respirator, even if it looks crazy on them, should wear that so that other people can have access to the disposable or reusable. And so that's why I acquired the ones I did. If you want to just Google 3M or NIOSH approved respirators, you'll get a lot of hits there so that you could see what you could purchase. I think that is a really good method of a reusable that I will plan on using. Another thing that I have seen that is not a commercial kit but has been developed is the Surgical Innovation Fellow at Boston Children's, I'm assuming Harvard-affiliated surgical residency program, has actually posted a video that you can find on their website that we can also put in the show notes, where they have used a bag valve mask and a filter from the hospital, from routine hospital equipment, in order to create what they believe to be a very effective respirator, and they performed aerosolized testing on each other. So if we're looking at what we believe to be high likelihood of successful strategies of respirators that are available, I think our industrial respirators that our friends in the painting industry and the construction industry have been using, and those are probably available those are becoming more difficult to purchase, but you could probably borrow from your friends if you needed to in those industries. And the other thing that I've seen is this video from Boston Children's, which I think could be made out of bag valve masks and filters from the hospital. As far as the homemade circuit goes, I think that there are 2 other things that are worth mentioning that would try to replace N95s, but not. One is a discussion of cutting up pieces of 3M filtrate or filtrates from industrial filters for furnaces, etc., that filter to a very low micron level, and then trying to sew those to cloth. And there's actually a nice video online with hundreds of thousands of hits now on YouTube, where a nice lady who is it sounds like a wedding dress sewer has actually put together a way that you can take apart a 3M filter, cut it up and apply it to other fabric, and then make it into a mask. Now, there's no way that we can believe that the seal is going to be as effective as within reality as we would hope it to be. But that is an option if we get into a difficult situation. Obviously, it's a costly option as well because these filters are not cheap. And finally, one other thing that I did run across in the Emerging Infectious Disease Journal, which actually had a link to the CDC website, and we can put this in the show notes as well, is in 2006, they put a novel approach of a T-shirt wrapped around the mouth and nose and thought it did provide some benefit. Although they did not believe that it was effective as an N95, they did believe that this T-shirt wrapped and tied behind the neck and the head in the way that it just demonstrated in the article, it did have some effectiveness, and they tested it against aerosolized particles and found that it did filter a significant portion of them. So those are most of the options I think we have for replacing respirators, which I think are of the greatest need now.
So if I learned nothing else on this podcast, I'm just excited I know who Bain is now, because you texted me that picture the other day and had Bain ? Underneath it, and I had no idea what you were talking about. So I'm glad I know it's a, what did you say,
he's the Superman
villain?
He's the bad guy on the third of the new Batmans.
Okay.
So that's the best I can describe as an old dad, is that on the Batman, the newest Batman movie, he was the bad guy, and he wore a mask, and he was bald like me, so I did look like Bane, only not quite as muscular.
Gotcha.
Well,
so that was
maybe as muscular, but maybe as muscular, but yeah, we'll see. We'll let the audience judge as to my physique.
So that was respirators. What about surgical masks? Do we have any options, because we're running low on those as well?
We got options, and again, we have to adjust our level of expectation. I think anything that we describe that's better than a bandana is what we're going for. So as I described earlier, this polypropylene substance is best because the way that it's uniformly distributed to filter to a very low micron level. But that industrial material is all but gone, and I found ways that you can get industrial-sized rolls of polypropylene, but it's pressed in different ways than this melt blown that I discussed earlier. And as you might imagine, I've been on the phone with my cousin who's a chemical engineer to discuss that beforehand. And so the way that the best single source that I have seen on this is, strangely enough, a website called smartairfilters.com, and they have gone through the best materials to make a do-it-yourself face mask. And they have quoted and cited a Cambridge study from 2013 that went over all of the different home materials and which of these home materials were most effective in removing and filtering to the highest level. And so they did these aerosolization and filtration tests, and what they essentially determined was that a surgical mask itself is about a 97 rating, filters about 97% of particles that cross over the barrier that are the size of bacteria. And then they did the same with several household items, and then they also did it for 0.02 micron particles, which are particles just underneath or around the size of COVID, which is probably an eighth of a micron. 0.02, obviously, is what they've studied here. And they've given the surgical mask, saying that it blocks out 89% as it goes across the surface. Interestingly enough, going downward in effectiveness, a vacuum cleaner bag was 86%, a dish towel 73%, cotton blend 70%, and on down the line, and ultimately stopping at a scarf, which is 49%. But what we see is somewhere between 50 to 70%, we can expect that a traditional at-home cloth that you have on your clothing, in your towels, or in your scarves, or in your pillowcases and sheets, essentially blocks 50 to 70% of particles the size of a virus that would be pushed across them in the study at Cambridge. And the surgical mask and the vacuum cleaner bag were at 89 and 86%. So if you take that, what they did is they didn't just stop there. They went ahead and actually double layered these materials and found that when they double layered them, they did not add to the effectiveness tremendously, but obviously they increased the heat and decreased the breathability. So as they went through the study, what they ultimately determined was their optimal combination was that a pillowcase laid across a cotton T-shirt was the most suitable household material for an improvised face mask when one judged comfort and breathability. Now, you probably ask, why not the dish towel, and why not the vacuum cleaner bag? Well, one of the vacuum cleaner companies just came out and says, don't be using our bags for face masks. That's a bad idea today. And that's sad that they had to do that, but they did. You may be asking why not a dish towel, but they found the dish towel to be very poorly breathable. So I think their idea is to combine cotton or layers of cotton, which are in the 50 to 70% filtration range, with a pillowcase layer, with an idea that you make 2 layers of that to help. Now, that was their recommendation from this Cambridge study, but I really have looked into it quite a bit over the last few days, more than probably I care to tell you, my wife cares to tell you, with regards to the time I spent on the internet talking to people who sew, talking to engineers, and talking to other doctors. And what I believe to be probably the optimal at this point is a 2-layered, if you talk about ease of creation and also best filtration, is a 2-layered, probably cotton or other fabric mask, where the back part of the mask actually has a slit that you can open up, and you can then place another item that is filterable, or that is as a filter that is different than the woven fabrics we're using. And among the suggestions I've seen are dried baby wipes, pieces of vacuum cleaners, pieces of industrial filters, or simply a Kleenex. And the concept being, no scientific proof here, of course, the concept being that you have 2 layers of a protection from a cloth woven material that may filter 50 to 60, 70% of the viruses that go across it. And then you put a non-woven material, industrial material, between it that's also breathable. So the idea that a tissue or a baby wipe, a pressed industrial substance rather than a woven substance, may also provide a different filtration and ability. And then the idea would be that you could bring home the face mask, you could hot water wash the face mask, take out the filter, and then replace the filter or find a new filter. And I think that what we're going to see over the next few days is the scientists are going to come out of the woodwork on these Facebook and chat groups and websites, and they're going to be suggesting better alternatives to a filter. But I think that right now, if we're trying to determine what our optimal creation of an at-home mask is, which I think you've seen a lot of mask groups, it would be a 2-sided mask with the back of it with an opening that you can pull open, and like a wallet, and you can slide in a filter that goes across the parts that would cover your mouth and your nostrils. So if you also want some more information and a great thread on this, there is a physician named Mark Lewis who has a pretty good Twitter following, and the thread that comes from his includes a lot of smart people who are discussing this same topic. So I'd recommend going to Mark Lewis's Twitter and looking at all the information that they've discussed on that.
So 50 to 70%, that's clearly not good enough for you and I in the emergency department. But the take-home point for me there is that it's probably better than nothing if you're at home.
It's better than nothing. It's better than nothing. And I think the other take-home point would be, not only is it better than nothing, but if we can convince not only people to have these as a backup in case of emergency, but if we can convince some of the people who peripherally operate in the general public, or who operate with patients that are very low risk, to use cloth masks in place of the people who are exposed to people who are fighting the infection, that might be an alternative if they began to wear the cloth mask and made the other paper masks more available, the polypropylene mask, so to speak.
So
now,
breathing it in, sorry, go ahead, Brian.
There's one other thing I would say is the CDC very explicitly on their website actually makes a comment about if you're going to use bandana. And what they said was, and their exact quote I think we should say is, in settings where face masks are not available, HCP might use homemade masks, e.g. bandana or scarf, for care of patients with COVID-19 as a last resort. However, homemade masks are not considered PPE since their capability to protect HCP is unknown. Caution should be exercised when using this option. Homemade masks, and this is a take-home point, homemade masks should ideally be used in combination with a face shield that covers the entire front, that extends to the chin or below, or the sides of the face. So what I would say that I'm taking from this with regards to a mask is, we're talking about an inferior mask that's, quote, better than nothing, and that can also replace the needs of lower risk workers compared to higher risk workers, so they could use the hospital masks. Or if we're in a desperate situation, a homemade mask combined with a face shield would be probably my next best line. If I was stuck there with a face shield and a homemade mask, I would feel like I had reasonable protection personally. And with regards to face shields, you can find those industrially. I actually picked up one myself at a hardware store when I picked up the masks. Those come over your face, much like the riot gear the police wear. But there actually is a group at the University of Wisconsin in their engineering department that have come up with a way to make these for $1.50 to $3, which is where they use a plastic that comes around the front and attaches to a headband. And I've also seen mentions online that people would use milk jugs, or they would use 2-liter bottles that would be cut open and then spread around so that they essentially form a semicircle cylinder in front of someone's face with a homemade mask underneath it.
So I'm going to try to summarize some of this because you've given us a lot of information. So something is better than nothing. We hope that we don't run out of things. We're going to conserve, do the best we can, and hope that someone out there is making more of the good stuff. But something's better than nothing if we're out, and you gave us some great options for that. The only real replacement for an N95 is an industrial respirator if you want kind of a similar quality. You mentioned a really great, from Boston's Children, there's the Innovations Fellow that's got a great way of solving this problem a little bit, so we'll link to that. As far as making masks, you went over that, but they're about as third or half as good as actual surgical masks if you're going to use reusable cloth. And you talked about using a replaceable filter maybe as a good option.
Yeah, that's what I would say.
What else? What else is a summary, and then what can people do out there? Is there anything that people just listening to this can do to help?
What I would say on the summary is there's no replacement for N95, like you said, except for trying to use the respirator or this technique at Boston Children's, and I've not looked into that enough. I would say that a 2-sided mask with a replaceable filter is probably your best mask, and I would follow those CDC recommendations. And if you're stuck using that cloth mask, then you should probably use a plastic shield over your face, which I think is a reasonable way of doubling down, belt and suspenders, so to speak. And then what I would say, what can a citizen do, or what can a person do? I think this is, first of all, I would say don't use up all the PPE. If you have an opportunity to get access to surgical masks, don't get them just so that you can go to a store or go to somewhere else. And I've seen people around the stores wearing those. Be considerate of your use of your PPE if you could. We understand you're scared, but there are people who are in much higher risk circumstances that could make use of those. Donate if you have gowns, gloves, masks. If you have old healthcare businesses or peripheral businesses that have these stockpiled, donate those if you can. I would follow along with your local efforts to see what people are doing. Are people creating masks in your community? Are they creating face shields out of industrial components in your community? Get involved. Make use of these days that you're forced to be at home, or that you're working from home, or that your children are running around the house and want an activity to do or a craft to do, and teach them something. I would say that really people should take this opportunity. I look back and I saw someone who recently gave a testimonial about World War II, and they had a rations book that their grandmother had shared and saved since World War II. And what they showed was that this rations book was nearly full. And back at those times, you were given rations books because you weren't able to go to the store and get more than your share. And he showed because his grandmother passed it down to him because she did not take more than her share. She felt like she was fighting the war in World War II by doing her part at home by not taking more than her share. And there's all sorts of stories of factory workers who worked over and over to create steel and create ships and create fighting materials for the United States in World War II. And I think the active citizen now wants to get involved in the same way. And so I think that although homemade PPE is certainly inferior, there is an opportunity for all of us to make a difference by chipping in the ways that we know how, by not overutilizing PPE, by trying to create masks, by trying to talk to your friends. I would encourage that this podcast today is maybe somewhat informative, but also a call out for questions and a call out for people with ideas. There are engineers listening to this. There are doctors. There are nurses. There are just smart MacGyvers at home. There are health-interested people. There are people with time and resources and friends. And I would recommend that if you have opportunities to find out better ways to do this, we would want to know. if this gives you an idea of the way that people are kicking in, today I got a text message, and I'm currently out of state for a couple of days, and I got a text message of a bag on my front porch, and what had happened was my cousin had heard about the lack of ability to get N95s, and he had talked to a friend of his at a power plant in another place in a rural area, and he brought home a respirator from the power plant and gave it to my cousin, who drove a 4-hour round trip to leave it on my front door because he did not want me to be without PPE. And that kind of sacrifice, that person that I vaguely knew from my hometown who went to the effort of acquiring me this respirator and sending it, and someone willing to drive it a 4-hour round trip just to keep me safe. And the reason that I really got involved in delving into this information, other than just for my own professional reasons, is I have a good friend in my hometown who wants to make masks, and she's an intelligent lady, and she didn't want to just make masks. She wanted us to find every piece of information to make the best mask possible for decreasing transmission. So I would say that for you guys out there listening, I would say if you have great ideas, please share them. Go to these resources, think, talk to network, and do what you can to contribute to the cause.
Brian, I really appreciate our last podcast that we did together. Afterwards, you texted me that you just got an email that a patient you had seen in the ER tested positive and you were exposed and you had to get tested as well. So I don't know if you've gotten your test result back yet.
I've not got my test result back, but I was certainly exposed in less than adequate PPE. Actually, I got caught with my pants down, so to speak, a little bit. I saw a patient early on before the illness had theoretically made it to my part of the country, except for in people with specific travel histories. And I did see the patient wearing a routine surgical mask, and the patient was given a routine respiratory mask, just like if they had influenza. And I recently found out that patient, it was at a time that we were unable to test in most places and did not have the opportunity to test that person. So I have been very thoughtful of that. And as I'm currently in a house with my in-laws who are of age that would be very vulnerable to COVID, I've certainly put a lot of worry into whether I've contracted it or not and whether I could have passed it along. So I think we'll all just need to be very vigilant as we go forward.
Well, we're all thinking about you. We appreciate that. I know your test is pending, but you're feeling great, so that's good. And you've been isolating, which is, I guess, giving you some time to really dig into this. So I really appreciate you sharing all this information. But, I mean, you're a perfect example of why this matters. So thank you so much, Brian. We're going to have you back on. If you have any questions for Dr. Adkins related to PPEs, let us know at Wild Health MD on our Instagram and Facebook, and we'll talk to you again soon.
Thanks so much for listening to this COVID-19 update. Please send us your questions or follow along on Instagram and Facebook at Wild Health MD. And just to be clear, this is not medical advice. No patient-physician relationship has been established, and this resource is really for general informational purposes only. And finally, if you want to spread the word, please send this podcast to friends and family and give us a review on iTunes. Thanks again, and stay safe.